Hello, everybody. I thought today's episode would be about chiropractic school. A lot of patients asked me about it. A lot of prospective students asked me about it. And not really prepared to answer that question, but I'll just try to give you a word salad of what might come out about that. I would say, you kind of have to look at it from a professional point of view, career point of view, goal-minded outcome point of view, investment point of view. The biggest question for me was insurance reimbursement, honestly. So I know Illinois has got strong laws. Actually, Illinois has got one of the strongest laws and scope of practices. So it kind of comes down to scope of practice. Kind of comes down to what you want to do once you're out in the real world, and how you want to do that and who you want to participate with. So there's a lot of behind the scenes stuff that most people don't end up seeing. So so there's things there. Illinois classifies chiropractors as physicians. Sometime back in the 80s, they lopped them into the same category as MD and DO, which are, so the difference with the license there is MD, DO are physician surgeons, licensed to perform surgery. Whereas chiropractic is just licensed as physician only. But it's all in the same category. Or continuing ed is the same. I think it's like 150 hours every 3 years, something like that. But yeah, you kind of, the field of chiropractic is so diverse. You have to kind of think of what because you got your whole life to learn about things. I always tell people, it's kind of like getting your license and what you want to do with that. So I can just speak for Illinois, but Illinois has got a wide open license, like kind of with physician status in a sense. Now, Chiros were never granted prescription drug rights. I think they can, they can order labs, they can draw blood, but they can't prescribe. So I actually went back to school for the family nurse practitioner to be able to prescribe, because I know I wanted that at some point. My ideal goal for me was a naturopathic physician, and I actually went out west for a few years to do training in that, but some personal things brought me back home. So I knew I always wanted to do that anyway, because naturopaths on the West Coast can prescribe medicines anyway and do all sorts of other injectables, vitamin injections, all sorts of stuff. So I just crafted my education to what I wanted for me. But if you're just sticking to chiro only, there's a lot of, so Illinois is a wide scope. You can do GYN exams, all pap smears, whatever, just any medical stuff. They try to, at National University where I went, they try to train you as a primary care provider. And a lot of my allopathic colleagues always wondered, like, how does that even work, since you have no medicines? So allopathic, they only think drugs is the only way to do it. So, I mean, they're like, how do you do that? That doesn't even make any sense. No license with medicines. But yeah, so throughout the curriculum, there was a lot of nutritional medicine focused on biochemistry, a lot of herbal medicine focused on, like how herbs affect various biochemical pathways and, a variety of pathologies. And then they also focused in on co-managing a variety of conditions, you know, like pretend like a patient was going to a rheumatologist, you know, for, you know, biologic medicines and such. But then, like, what do you do functionally to like support that patient with nutrition and acupuncture and chiropractic and things like that? There was acupuncture certification at chiropractic school, which I ended up doing. Well, that's a long story. I ended up doing the coursework. So that's cool. And chiros in Illinois can do acupuncture. What else? Yeah, so it just depends. Like, you know, the school in Iowa where chiropractic started, Palmer, very, very like vitalistic chiropractic school, in the sense that they look at the problem just chiropractically. Like, okay, the patient has the flu. What kind of, you know, chiropractic adjustments could treat the neurologic pathways that go to the immune system for like flu-like symptoms and stuff. And matter of fact, in the early 1900s, actually might have been all the way up to 1950 or something, they had chiropractic hospitals. Like, people would actually go and you would be like inpatient at these hospitals where you'd do all these therapy treatments, and you'd get adjustments like 3 to 4 times a day, and it was like huge. There was a famous Dr. Gonstead. He has a technique named after him. I can't remember where that is. Missouri, maybe? Can't remember. He had his own airport and inpatient facility. People around the world would fly into him and have inpatient, you know, treatment plans for a variety of ailments. So it really depends. If you go like vitalistically, there's like 2 kinds of schools of chiropractic. Vitalistic is like the body can heal itself. You just remove the nerve interference through adjustments, and like the body can just do the rest, you know. Like, so there's 4-year programs that teach just that, you know. So versus like where I went, national, there was like not that. It was like, here's all this other stuff, you know, therapies, nutrition, herbs, acupuncture, adjustments, and you can treat the patient holistically with all that. So there's 2 schools of thought, and there's some school, like with anything, there's some schools that lean all the way over there, and then there's some schools that lean all the way over there, and then some in the middle, perhaps. So the one I went to was extremely medicalized, which I am grateful for, because a lot of educational, I would say a lot of education was basic science, laboratory science, all the rigmarole that MDs take. Some of the subject matters we did way more hours, because they go into clinical stuff way more readily, and then we didn't have so much clinical. We just had like classroom time. But like gross anatomy lab was just unbelievably more in depth. It was probably 2 or 3 times more in depth than a regular medical doctor would get. Physiology with physiology lab, it was probably on par. Microbiology was probably less, because we don't prescribe medications. The medical people use that more with prescriptions and antibiotics and stuff. Biochemistry was probably on par. Histology was probably on par. I can't remember. Histology, biochemistry, physiology, anatomy. Like, we had tons and tons of so they call those basic sciences, like how the human body works. And then we had a whole bunch of like clinical science, but it was more, again, like small group learning, classroom, case study analysis, stuff like that. Or I bet you the MDs get into the hospital quick and then they start like rotating around and seeing what's going on and doing other things. So there are differences, like especially if you want to just go towards more medical things, I probably wouldn't do chiropractic school, honestly. Yeah, but some of the schools teach a lot of medical stuff. We did have adjusting labs, physiotherapy labs. Obviously we had, I think there was like 3 or 4 trimesters of clinic with a variety of outpatient requirements, sensitive exams. It's more medical stuff. You know, X amount of adjustments, X amount of physiotherapy, X amount of blood draws, X amount of, I don't remember anymore. But, you know, you get a lot of that. And the second part of the educational process in the chiropractic school that I went to included like just a ton of radiology, like how to interpret pathological changes on radiographs, a lot of autoimmune conditions, cancer, sarcomas, you know, carcinomas, all sorts of stuff. And then there was also a lot of case study, small group stuff on differential diagnosis, especially medical stuff. They always wanted you to like be able to spot, identify, and take appropriate action for people that had like needed specialty care, especially oncology stuff, rheumatology stuff, general primary care stuff like colds and flus, thyroid, endocrine stuff. So the education was really complete. You could sit down with an MD anytime you want and just have a discussion about anything. But there was not a lot of drugs incorporated because chiros don't prescribe. You know, and then it just depends on what state you want to be in. Like I know I have friends in California. They just have cash practices and they just hit it hard with holistic stuff and adjusting and nutrition and muscle testing and all sorts of things. It's all cash, you know, so like some people have like super success with the California model, because like California doesn't even reimburse chiropractic, or if it does, it's minimal. Some places like Illinois has heavy reimbursements, so then people gravitate more towards what insurance is paying. So if you do decide to go to chiropractic school, make sure you know like which state you want to go to, what style of practice you want to have, and then what kind of school will teach you some of the basics, foundational stuff, like the way you want to practice and what you want to be doing with people. So hopefully that gave you a lot of info. I know I didn't get into the nuts and bolts, but you know, whatever. I think that's like a good overview. So I hope you enjoyed this video. Like, subscribe, share, tell all your friends, and send this video to anyone that you think would benefit from it. Take care, guys. Bye.